To the dissection of the neck. Now we have taken incision from the symphysis menti up to the angle of the mandible. Then one incision from the symphysis menti to the jugular notch. We are reflecting the skin. Here this is the fascia of the neck. In this the platysma muscle is there. The platysma muscle takes origin from the superficial fascia and gets inserted on the body of the mandible lower border. Now from the both sides the superficial fascia is removed. Here, after removing the superficial fascia, here is the submandibular salivary gland. Now on the lateral side of the submandibular salivary gland, here is the facial vein. This is the tributary of the internal jugular vein. At this level, there are two tributaries from the thyroid gland. This is thyroid gland. There will be the superior thyroid vein, middle thyroid vein. They will enter or they will drain the blood into internal jugular vein. The internal jugular vein is continuation of from the jugular foramen. It is continuation of the sigmoid sinus. From there, it enters the neck and goes to the thorax, and it will join to the external jugular vein and form there the subclavian vein. Now, below that, here is this is the common carotid artery. The internal jugular vein, common carotid artery, and posterior to this artery, this is the vagus nerve. These three are having a common sheath, that is the carotid sheath. These all structures are present in the carotid triangle. After removal of the sheath, these structures are visible. This is internal jugular vein, this is common carotid artery, and this is the vagus nerve here. Now here on the superficial side, you are seeing the external laryngeal nerve. Now the muscles of the neck, that is the muscular triangle of the neck. Here is the thyroid cartilage. Below the thyroid cartilage, this is the cricoid cartilage. On the anterior side, here you are seeing this is the anterior jugular vein. This is the anterior jugular vein. Now, here you are seeing the muscles. This is the superior belly of the omohyoid. Then from the sternum to the hyoid, this is the sternohyoid muscle. Then when we'll separate this or remove on the lateral side, there is one more muscle here. From the sternum to the cricoid, this is the sternocricoid. From the sternum to the hyoid, this is the sternohyoid muscle. And from the thyroid to the hyoid, that is the thyrohyoid muscle. So these are the muscles present in the muscular triangle. Now here you are seeing the two bellies of the sternocleidomastoid. This is the sternal angle, sternal belly from the sternum, and this is from the clavicular head. So this is the sternal head, clavicular head, and that will go and get insertion on the mastoid bone. So this is the sternocleidomastoid. Now here is the submandibular salivary gland. On the either side also you are seeing the submandibular salivary gland from this side. Here. On this side we have done the dissection. Here is the submandibular salivary gland. This is the external common carotid artery. The bifurcation of these two arteries here. This is the internal carotid artery, external carotid artery. This is the superior thyroid artery supplying the thyroid gland. This is the thyroid gland, right lobe of the thyroid gland. Here you are now seeing this is the facial artery and vein here. Now this is the anterior belly of the digastric muscle. Then this is the stylohyoid muscle. Here is the mylohyoid muscle, which will form the floor of the submental triangle. So this is the submental triangle, this is the carotid triangle and its contents. Here is the digastric triangle and this is the muscular triangle. So these are covering the structures on the anterior triangles of the neck.